My name is Harpreet Sandhu. I'm the Director of Donor Services at Stanford Blood Center. I'll be taking a few minutes to talk you through the blood donation process. When you come in to donate blood, you'll be greeted by one of our friendly registrars. They'll identify you. If you have a donor ID card, please bring that in. That will expedite this process. And then we will ask you to reconfirm your identity several times throughout the process. If you don't have a donor ID card and you're a first-time donor, you must bring in a picture identification. Once you finish checking in with the registrar and you've read the donor education material, you'll be asked to answer a series of questions regarding your medical and travel history. You will be answering these questions in a confidential environment. The FDA mandates that blood centers ask blood donors these questions every single time. Your honesty is critical. The safety of the blood supply and the patients receiving blood depend on honest answers. Once you have completed the questionnaire, you'll have the opportunity to review and change answers if needed. The next part of the process is highly confidential. You'll be invited into a confidential history booth by one of our staff members. At this point, we will reconfirm your identity. A trained staff member will review the answers to your medical history questionnaire and check your vitals.
And you've been outside the United States and Canada in the past 3 years?
Yes, I have.
Okay, where'd you go?
I went to, let's see.
You or one of our staff members may find that you are not eligible to donate blood today. You will then be provided some specific information regarding your deferral from our staff.
The last thing I want you to do is take a moment to consider one more time if your blood is safe to be used in transfusion.
Okay.
If you feel you may have been exposed to infectious disease or your blood is not safe, I want you to peel the "Don't Use" sticker off and place it in that box.
Okay.
Regardless of which you choose, your blood is going to be taken. We're going to test it and we'll notify you of any positive results.
You will then move on to the phlebotomy floor and have a seat in one of our comfortable donor chairs. At this point, we're going to reconfirm your identity again. One of our trained staff members will then perform a vein assessment and perform the arm scrub procedure. The arm scrub ensures your safety as a blood donor and the safety of the blood supply. Next, our staff member will perform the phlebotomy. You may feel a small pinch, but most donors say this only lasts a few seconds. Once the needle is in your arm, the entire whole blood donation process will take approximately 7 minutes. It helps to be well hydrated prior to your donation. Drink plenty of fluids the day of and the day prior to coming into the blood center. Once the donation process is complete, your arm will be wrapped. Keep this bandage clean and dry for about 4 hours after your donation. Next, you'll be escorted to an area where you can have something to eat, drink, and relax after your donation. We call this the canteen. We'll ask you to stay in the canteen for about 15 minutes so we can keep an eye on you. Studies show that most post-donation reactions occur within the first 15 minutes after you donate blood. If you feel lightheaded, let one of our staff members know. To help you replenish your fluids, there's plenty of juices available, including our famous POG, which is Passion Orange Guava. You've done a great thing today for the patients in our community. Now take a little time for yourself. Try and refrain from strenuous activity for at least 24 hours, and keep your bandage clean and dry for the next 4 hours. Thank you for giving blood, and welcome to Stanford Blood Center.